By the time this video ends, artificial intelligence in the United States will help decide who gets a cancer screening, whose heart rhythm is considered dangerous, and who feels reassured enough not to see a doctor at all. This isn't speculation, it's already happening. In fact, 2 out of 3 U.S. doctors now use AI in their daily work, often without patients realizing it. AI isn't coming to healthcare someday, it's quietly embedded in your life right now, shaping your health, your habits, and your decisions. Let's start with medicine. According to the American Medical Association, AI adoption among U.S. physicians jumped to 66% in 2024, nearly doubling in just 1 year. Doctors aren't using it to replace themselves, they're using it to write notes, summarize visits, and analyze scans. At the same time, the U.S. Food and Drug Administration reports over 880 AI-powered medical devices approved for clinical use, most analyzing X-rays, CT scans, and MRIs. And here's where it gets surprising. Some tools don't just help doctors, they reduce doctor visits altogether. An FDA-cleared skin cancer screening app showed that over 50% of users with benign lesions felt confident enough not to schedule a follow-up appointment after an AI evaluation. AI is no longer just assisting healthcare. It's filtering who even enters the system. Now let's leave the clinic and look at your wrist. In the United States, over 40% of adults use health-related apps, and about 35% use wearable health devices like smartwatches. Another survey found 44% of Americans own a wearable device, and most use it for health monitoring, not just fitness. These devices use AI to detect irregular heart rhythms, analyze sleep quality, estimate stress and recovery, flag early warning signs for health issues. Your heart rate is no longer just a number. AI turns it into a prediction. And the market reflects this. The wearable health sector is expected to grow dramatically over the next decade. Now for the most unexpected area, mental health. A study in JAMA Network Open found that 13% of U.S. adolescents and young adults use AI chatbots for mental health advice, and over 90% of those users found it helpful. At the same time, the American Psychological Association reports that over half of U.S. psychologists now use AI tools, mainly for documentation and treatment planning. For many people, AI offers instant emotional support, always available. But experts warn it can occasionally produce inaccurate or misleading emotional guidance, reminding us that AI should be an assistant, not a replacement. AI in mental health is both a lifeline and a risk we're still learning to navigate. Health isn't just medical anymore, it's lifestyle. AI-powered wellness apps now analyze photos of your meals, track activity and glucose, and adapt diet recommendations in real time. Industry reports show that AI in wellness and nutrition apps is one of the fastest-growing segments in consumer health tech. This means your smartphone could be tailoring your diet based on your unique data, not generic advice. If you want to know where the future is headed, follow the investment. In 2024, over 40% of all U.S. digital health funding went to AI-based companies. Investors aren't funding gimmicks, they're backing a shift from treating illness to preventing it. So here's the reality. AI already influences when you see a doctor, how scans are read, how your body is monitored, even what your phone suggests you eat. The real question isn't, will AI change healthcare? It's, do you know where AI is already making decisions for you? Because the future of health isn't either human or machine, it's both, quietly shaping your life right now.